So like she said, my talk is on mental health issues in children and adolescents with CF, and I did add caregivers there because this really is a whole family affair. The learning objectives, that was great. We're going to review common mental health issues related to CF, as well as the prevalence, address parental mental health, so parents, we aren't off the hook here. Tips for building resilience in children and teens with CF. We're going to discuss wellness and protective factors, when to seek help, and then I'll share some resources and supports as well. So common issues in CF that impact mental health. So these are the most common stressors I hear when meeting with families that can definitely have an impact on mental health and wellness within the family system. So some of this is for parents as well as the kids, but for parents, there's the initial grief and guilt at time of diagnosis that I often hear about, in addition to ongoing fear and worry for your child's future. Then comes the stress of coordinating care, managing the treatment routine, making sure they're eating and gaining weight, navigating insurance and coverage issues, basically taking on the role of nurse, case manager, care coordinator, and also trying to be a parent. You are all very familiar with this. For patients, the additional stress is commonly found in the treatment burden, exposure to medical trauma, weight and food issues that can often lead to picky or disordered eating or even body image issues, sleep issues, fear of judgment, embarrassment, isolation, and impact on self-esteem, and the list goes on. We could add many more here as well. Any one of these things can really impact mental health, can lead to anxiety and depression and just overall stress on the family. And so this is a lot. We're going to talk about how to best cope with these stressors and how to raise resilient children with CF. And there is hope with new medications. The world of CF is evolving and changing and hopefully lessening some of these burdens. But I know there's a handful that still don't have access to genetic modulators, and this is still your reality. And frankly, even with modulators, this can still be common stressors in the family. So I want to touch on the prevalence of mental health issues in CF because anxiety and depression is 2 to 3 times greater in the CF community compared to the general population. And this is why we screen regularly for anxiety and depression when you're in clinic. And this comes from the CF Tide study, which was an international study done in 2014 that found elevations of depression in 10% of adolescents, 19% of adults, 31% of fathers, and 37% of mothers. Similarly, with anxiety, elevation was found in 22% of adolescents, 32% of adults, 36% of fathers, and 48% of mothers. So as you can see, the highest anxiety and depression was found in CF caregivers, specifically mothers, and adolescents whose parents reported depression and anxiety were more likely to be elevated as well. So knowing this, we're going to focus on caregivers first because your mental health is one of the greatest indicators for your child's mental health. So I'm calling all parents to be the second chicken. So what does this mean? This comes from a book, Opposite of Worry by Lawrence Cohen, where he talks about how frightened chicks will experience tonic immobilization when there's a threat in the environment. So they'll hide, they'll freeze, they'll lie down if there's like a hawk flying overhead. And what we know is that chicks will experience this immobilization for shorter periods of time if there's a second chicken acting as if everything's okay. So if they're walking around the environment and they're not getting harmed, things must be okay. So parents are the second chicken for their children. Your kids will look to you for cues about how nervous or relaxed they should be. If you're flooded with your own anxiety, your own fears, your own mental health issues, you cannot be that second chicken for your kids. So you have to find your own stability first. You can't give what you don't have. So how do we be the second chicken? So as parents, I'm really going to call on you to seek your own support and really normalize therapy as much as possible. So I use the metaphor a lot when I meet with families to unload your backpack. We all carry an emotional backpack around all day long that gets filled with kind of these giant rocks every time we experience a stressor, come in contact with some anxiety, or just have an emotional reaction to something. At some point, you have to unload your backpack. It will inevitably rip open. So address your own anxiety, fears, loss, stress, especially this past year and a half with COVID, with parents becoming homeschool teachers, with political conflict. There's so much heightened stress we're all carrying around. So we really need to pay attention to our own backpack. You will be less triggered by stressors in life when you've already named and processed them. So when you're in a regular therapy relationship or just have some self-care where you can unload your backpack, these rocks and emotional experiences and stressors will just feel less heavy and you're more equipped to manage them. Think of therapy as a gym membership. for your emotional and mental health. So we don't prioritize our mental health in the same way we prioritize our physical health. There's still a lot of stigma and bias. But if you can think about it like a gym membership for your mental and emotional health, a place that you can go kind of burn off that steam and process the difficult things, I think we can really try to normalize therapy. Don't wait for a crisis. So don't wait until you're drowning to learn how to swim. You do not have to have a diagnosable mental illness to seek therapy. Like I said in that first slide, any one of those things can lead you to want more support and extra help. So don't wait for that crisis. Therapy can help you learn those coping skills and strategies to really maintain your stability in mental health. Learn research-based parenting strategies and understand child-teen development. So as we all know, kids don't come with a rule book. And we're all doing the best we can, but there are experts in child development. There's experts in now what we know about brain development and neuroscience that can impact parenting strategies. So seek out that expertise. And reparenting. Having kids will inevitably trigger any unresolved issues you may have from your own childhood or with your own parents. And so therapy is that place where you can process some of those issues from your own childhood and break generational cycles in your own parenting. So moving on to young children. So how do we help our kids cope with CF and some of these stressors that we know will impact mental health? And I want to focus on building resilience in young children with CF. So talk openly about CF. Give opportunities for your child to ask questions and provide simple, honest, age-appropriate answers. So we often want to shield or protect our kids from hard topics, but kids are perceptive. If you are avoiding questions or topics about CF or mental health or other stressors, it will create more uncertainty and fear. So talk openly about some of the hard parts of CF, and it will demystify them and creates an environment where these topics are really normal and safe. Kids can understand far more than we give them credit for. So a 4 or 5-year-old can understand that they do their best to keep their lungs healthy, or they take enzymes so their tummy doesn't hurt, and really normalize feelings about CF. So this can sound like, I bet there's a part of you that doesn't mind having CF, and part of you that finds it hard at times. And just open that up and see how your kids respond. Just give them some of those opportunities to talk about their feelings and say some things like, it's okay to feel annoyed at times, and it's okay to feel frustrated at times. And it really lets them normalize these hard things and know this is a safe place to talk about that. Teach and model emotion regulation and coping. Express, not suppress. So emotional suppression is not emotional regulation. We need to help kids identify their feelings and express them. And this can be really difficult if you didn't grow up in a house where emotions were expressed or allowed. So that's where their reparenting comes in a little bit. But let them unload their little backpack. So they also have experiences and stressors throughout the day and emotions that build up. So they also need a place to unload that. Name it to tame it is a great strategy here to help with regulation. Verbally naming emotions calms the nervous system, because it engages that prefrontal cortex, which is responsible for our executive functioning and regulation. So naming emotions for your kids can really help build up that regulation and coping skills. And this can sound like you feel super upset about that. It's okay to feel upset. I remember a time I felt upset and it was really hard. So sharing your own emotions, joining them in that, and maybe telling about how you cope with your big feelings as well. Give opportunities for kids to master fears and build resilience. Try not to avoid new or fearful situations when your child is ready, like sleepovers or summer camps. And I know this can be anxiety-provoking for parents to give up some control, like will they get their enzymes or will they get their treatment when they're supposed to? When we avoid new or fearful situations for either us or our kids, it's affirming that they should be scared of this or they should be embarrassed by this. And so what we want to do is tolerate that distress with connection and validation, rather than fixing or rescuing. If we avoid, we take away the opportunity for our kids to build their distress tolerance skills and resilience to face adversity. So just because something is uncomfortable or fearful doesn't mean it's bad or wrong. It means it's new and overwhelming. So let's acknowledge those feelings and work through them with our kids. And lastly, play. So children will not come home from school or daycare and say, they had a really hard day, I need to talk. They'll often say, can you play with me? So play is extremely regulating and stabilizing for kids. It's where children make sense of their world. It's where they work out abstract thoughts and emotions. And it can also be where they unload their backpack. and laugh and find connection with you. Even 10 minutes a day of uninterrupted intentional playtime with a parent can do wonders on a child's connection, belonging, and behavior. I have 2 at home, and this has worked. It's magic, so try that. So moving on to teens, we want to carry a lot of that forward, and it's kind of similar, just gets a little bit more complex, but we want to keep them talking, so maintain connection. And keep them talking with you and be available when they are to talk, which for teens is a lot of time at night. So just be around, hang out at nighttime. That's when teens often feel a little more open and vulnerable to talk, and let them unload their backpack, which is just a little bigger and a little more complicated than our younger kids. So teens are usually going through self-esteem issues, identity formation, body image, peer influence, and social media, among many, many other things. And so we want to be a place where we can connect and talk with them about these things. And teens often, we may think they're trying to push us away. And while they may need more space and independence, they also need unconditional love and affirmation more than ever before to build up their self-esteem and confidence. And really listen and validate emotions versus fixing and giving advice. So when they're sharing problems, they might not always want a solution right away. They want you to join them in those feelings. So again, really model some of the times that you felt similar and validate their feelings. And then encourage therapy during this stage. This is such a great stage for kids to be in therapy, just with adolescents in general, let alone having CF on top of that. That they can learn coping skills, increase self-esteem, gain interpersonal effectiveness, manage stress, and just have another safe adult to talk to. Understand changes in adolescent brain development and how to increase emotion regulation and coping. So name it to tame it. That strategy still works here. There is so much brain development happening during adolescence. That prefrontal cortex is really under construction during this phase of adolescence. And that is the part of the brain responsible for regulating emotions, problem solving, impulse control, future-oriented thinking. It just takes teens longer to access their prefrontal cortex. So that may often lead to big, intense emotional reactions and frustration tolerance, low frustration tolerance. So they're often not trying to be terrible humans. They just take longer to access some of that regulation. So share your own emotions and how you deal with them, and really model this for your kids. So again, naming their emotions, validating them, and sharing a time you might felt similar. And then utilizing coping skills and modeling that for your kids. So doing some deep breathing, going for a walk, doing yoga, or watching a funny TV show on a hard day lets them see your own coping skills and how you manage your stress and emotions. And similar to the last slide, we want to encourage openness with CF. Don't give CF more power by keeping it hidden and private. So every family has their own comfort level here. However, kids that feel supported in their CF amongst peers tend to do better managing their care versus those that are embarrassed and won't take enzymes when they're out with friends or suppress their cough in class because they don't want to feel different. We really want to validate these emotions and allow for some of that discomfort if you can. It's hard being a teen, and even harder having a chronic illness on top of that makes you feel different, which is why we want to create openness early on to build up that confidence and self-esteem and have that peer support. And it's always helpful, I feel, to ask kids, what would you tell a friend in this situation if there is something that's bringing them discomfort or something that they're embarrassed about? And more often than not, it allows them to see that other kids have insecurities just like they do, but really help kind of build up that openness. And have a CF role model, peer support, create connection. Peers are everything during this stage, and friendships are so important. And so if you can create connection around their CF, it's a little less isolating for them. The CF Warrior Project I put up here is a great book with just different stories of people with CF from all different backgrounds and ages, and lets kids see other people that are living with this disease. I also had a patient that became very resistant to her treatments during adolescence, which is fairly common, and was really avoiding her CF. And she met 2 other people on Instagram with CF, and they became friends and really were able to support each other. And she was able to engage much better with her care and with her CF. CF became the connection between them instead of the thing that set them apart. So I think it's really important to create that connection for kids. So I want to go over some wellness and protective factors to help our kids kind of maintain their stability and mental health. So sleep is huge, and most kids these days aren't getting the sleep they need. For 6 to 12-year-olds, we should be promoting about 9 to 12 hours of sleep a night. Teenagers 13 to 18 should be getting 8 to 10. And this improves attention, behavior, learning, memory, emotion regulation. I mean, it's a big deal. So really try to promote and protect sleep as much as you can for your kids. Turn screens off 30 minutes before bedtime and keep them out of their bedroom. Exercise is also really important and beneficial for mental health. Preschool-aged children should be physically active really throughout the day. I know mine is at home. I can't keep up with them, so that's a fairly natural process. But for older kids and school-aged kids, about 60 minutes of moderate to vigorous exercise a day. It's a natural mood booster. It improves thinking and cognition, reduces risk of depression and anxiety, and helps you sleep better. Time in nature, 15 minutes a day can result in decreased stress and increased anxiety recovery. So try to get your kids outside as much as possible. Mindfulness and deep breathing, these are evidence-based strategies to reduce stress and it increases emotional regulation. And this is used a lot in classrooms now, which I think is great. And there's a lot of apps for your phone. So you can download apps on your phone to take breaks for mindfulness that remind you to do some deep breathing exercises and can help with that regulation throughout the day. A healthy diet, I know Caitlin's going to touch on this later, but it does impact mood, energy, and alertness. So it does impact mental health in the same way it does physical health. And then peer connection and fun activities. I talked about this a little bit in the last slide, but we're wired to be in relationship and want to feel seen and supported. And fun activities make us feel better. So make sure your kids are still engaged in fun activities, fun family time or family traditions. Social media limits and boundaries. This could be a talk all in and of itself. But there's a strong correlation between social media use and increased anxiety and depression and self-harm, especially for teen girls. So if you can hold off on social media access for as long as possible, I recommend it. It can be harmful for kids' social, emotional development and self-esteem. And this one is so hard because all kids have a phone now, and the pressure to fit in and the fear of missing out is real. However, we know more research and data about this and how harmful it can be. And so if all the parents could join together and turn the tide on when this is appropriate for kids, that would be great. If they are on social media, closely monitor it and help them think critically about what they're viewing and what messages are being portrayed. They're not just absorbing negative messages. And then caring and supportive adult relationships. So a stable and supportive parent, caregiver, or adult is the single most common factor for children to develop resilience. So make sure they have lots of good adult relationships in their life. And when to seek more help. So since I didn't touch on specific mental health disorders and symptoms, I want to briefly share some red flags and things you can watch for. So first, I want to really normalize therapy is for everyone at any time. So don't wait until you think there's a red flag to seek therapy. But things to watch for: if your child is struggling with depression, anxiety, or an emotional disturbance that is present almost every day and interferes with daily functioning, day-to-day activities with school, family, peers, or social situations, seek professional help. So this can look like behavior or mood changes that are really unusual for your child. Like they love playing basketball and now they don't want to. Or they loved going to school and now they seem to avoid it. Or they're really irritable when more often than not they're pretty happy and upbeat. So those are things to pay attention to. And notice mood changes as well as physical symptoms such as fatigue, sleep difficulties, appetite changes, muscle tension, headaches, stomach aches. These are the common signs of depression and anxiety, and usually what kids will verbalize first. So they're often not going to always share about a breakup they had or some friendship dynamics that they're struggling with. They're going to say, I've had a stomach ache for the last couple of days, or I've had a headache that just won't go away. So pay attention to those physical signs because there could be just more going on. And I'm happy to help tease out these situations. If you feel like you have a situation where you're not sure if this is mental health related, or if you just want more support in general. I provide psychotherapy. I also provide referrals in your community. So please reach out if you have a situation you'd like to discuss. And then these are resources. I'm not going to go through all of them. I'm going to send these out to everyone via email, so you can get these resources in your email and look through them. But these are great books for parenting strategies, parenting using a lot of the brain research we now know and what's happening for your children during different stages of development. There's some great podcasts and web resources out there for parenting. Good Inside with Dr. Becky is one of my current favorites right now. She's just excellent at giving really tangible parenting tips and strategies. Better Help in Psychology Today can help you find therapists online as well. And then these are different apps. Again, I'm going to send all this out because it's a lot to digest right now, but that can be on your phone for young kids all the way up to adolescents and adults for mindfulness and deep breathing strategies that they can use throughout the day. And then I want to end with Fred Rogers. Anything that's human is mentionable, and anything that is mentionable can be manageable. When we can talk about our feelings, they become less overwhelming, less upsetting, and less scary. I'm happy to take any questions or comments, and this is my information, so don't hesitate to reach out at a later time as well. Thank you.